Ever since I was a little kid, I've been fascinated with the sciences. I always loved knowing that we had a way of investigating the world and solving all of the problems that we could find in it. And as I got older and started thinking about what I want to do with my life, I realized that I wanted to do something where I could have a tangible, real impact on other people. And as I got older, I found that medicine was really the perfect marriage of those two aspects of my life, a marriage of science and wanting to help people. And once I started going along the medical career, I found that neurosurgery in particular really offers a great avenue for this. We get to take the most technologically advanced aspects of medical science that there are and apply them into real-world ways of tangibly helping people and making a significant difference in their lives. So I think most physicians would agree that probably the most rewarding part of their field is seeing the difference they can make on people's lives. Having someone whose intractable pain is resolved after spine surgery, or whose paralysis suddenly improves after doing an emergent intervention for an acute stroke. These are all situations that we find profoundly rewarding and ultimately why most of us, I think, get into this field to begin with. But there is another scenario that I also find very rewarding that I think often gets overlooked. And that's when you see that light bulb go off in the patient's mind when you're talking about their neurological illness. We get a lot of patients who come to us without a really clear understanding of what's going on with them. Why are they having these symptoms? What is going on in their body? What is their body telling them? And to be able to sit down with a patient and go through all aspects of their neurological illness, the anatomy, what imbalances could possibly be going on in their body. I think seeing that aha moment for a patient where their illness really makes sense to them is not only a very important part of what we do as neurosurgeons, but also a very rewarding part of that job as well. And my other favorite part to that is when, after that conversation, we get to look them in the eye and say, and here's how we're going to fix it. I think the one question I would encourage a lot of patients to ask, and not all of them do, is what are the best non-surgical options available for me? I think as surgeons, it's very important that we get a comprehensive understanding of neurological illnesses that we're treating, and this includes surgical care as well as non-surgical options. And navigating that with a patient is very important. Every patient is different, and we have to create a individualized treatment strategy for every patient based on their own values and their own goals for what they want out of their care. And I'm a firm believer that not only is navigating that with the patient such a critical part of what we have to offer, but also that surgical options should really only be pursued when it is the best option available that's left for that patient in accomplishing the goals that they want with their care. I'm Dr. Richard Schmidt. My mission at Jefferson is to improve lives.